Everyone, my name is Sophia, and today I'll be talking about my comp exam that I did on the safe and effective nutritional and exercise strategies for weight cutting in MMA. So, a brief introduction. MMA is a full contact sport in which athletes compete and punch each other in the face. They compete in specific weight categories. Example is Conor McGregor. He competed both divisions, the lightweight division at 155 pounds and the featherweight division 145 pounds. And so weight cutting is an umbrella term used to define body mass loss using multiple strategies that can be divided into two. Chronic weight loss that is usually months to weeks long, leading to an event, and also acute weight loss that is 7 to 14 days leading to an event. And so the problem lies on the weight category requirement, and which has created unique weight cutting cultures, behaviors, and practices, many of which are detrimental to health and performance. And another problem is athletes compete at a weight category that's incompatible with their habitual weight class. And so that tells us a little bit about their ability to maintain their weight before competition, after competition, and it may be due to inappropriate weight management, like poor training, periodization, and nutritional habits. And another problem is the belief that cutting weight is going to give them a physiological advantage. Like they're going to compete against someone that's going to be smaller and they're going to be bigger once they get in the fight. However, there's not enough evidence to suggest this. It's true. And so a little bit of prevalence information survey by Parks and colleagues showed that 98% of professional MMA athletes report using acute weight loss methods, but only 20% of MMA athletes of all levels reported using the help of a registered dietitian or nutritionist for dietary advice for cutting weight. So this is extremely problematic. And so the purpose of this review was to provide information that would help athletes, coaches, and other professionals navigate through adequate nutritional and exercise strategies for combat athletes. And so there is the need for safe and effective nutritional and exercise strategies for weight cutting in MMA. And how? Well, applying principles of sports nutrition and training periodization, specifically to the sport and MMA athletes. And so now I'll be talking about a little bit of the difference between acute and chronic weight loss strategies. And so for chronic weight loss is usually achieved via an accumulated energy deficit, which is accomplished by the manipulation of either or both energy intake, that would be your diet, and energy expenditure, that's the exercise, in which it is very common for athletes to follow a diet that is less than 10 calories per kilogram of fat-free mass a day. And they are going to engage in this energy deficit for 8 to 12 weeks long, nonstop, in preparation for their fight. And 5 popular acute weight loss methods that fighters use to make weight are food restriction, like energy deficit, water loading, increased training or energy expenditure, sauna use, and sweatsuit use. And so what are the physiological consequences? Well, when engaging in chronic weight loss, the accumulated energy deficit for prolonged periods of time can induce the male athlete triad or relative energy deficiency in sports. And so this low energy availability is associated with the disruption of resting metabolic rate, impaired hypothalamic pituitary gonadal axis, suppression of reproductive function, and impaired bone health. In regards to acute weight loss strategies, which predominantly manipulate total body water that cause dehydration, it is well established that 2% body weight loss impairs performance, increases blood viscosity, thus increasing the risk of ischemic heart disease and stroke. It alters the brain morphology and potentially increases the risk of brain injury, which is a very bad thing, specifically for these athletes that punch each other in the face for money. And so in this case study, a professional MMA athlete showed that extreme weight making causes REDS, relative energy deficiency in sport, dehydration, all the negative effects that come with it, and acute kidney injury. So there was an 8-week phased weight loss. And so for phase 1, the athlete underwent 7 weeks of energy intake between 1,300 and 1,900 kcals. Phase 2 consisted of 5-day water loading, which I'll explain the protocol in the following slides. Phase 3 consisted of just 20 hours of fasting and dehydration, and phase 4 consisted of, after weighing in, a rehydration and refueling 32 hours prior to a simulated competition. The results showed that indeed the athlete showed REDS, dehydration of 9.3% of body mass loss, hypernatremia shown by the plasma sodium of 148 millimoles, and kidney injury, hypercholesterolemia, and the inability to perform the performance test. So this case study confirms the detrimental consequences of cutting weight and their impact on health and performance. And so now I'll be talking about the safe and effective nutritional strategies that MMA athletes can use to cut weight. And so in regards to chronic weight loss, a better approach can be the manipulation of energy intake and exercise energy expenditure. And so this can be done creating fluctuations in daily low energy availability. For example, days in which an athlete has higher training volume, they can ingest higher calories and ingest less calories the days of that their training volume is low, making sure that at the end of the week they're still on that weekly caloric deficit. In the case study by Lang and Evans, it showed that this manipulation of fluctuations in daily low energy availability reduces impairments to metabolic rate, immunity, protein synthesis, and cardiovascular function. And now in regards to the acute weight loss methods, acute strategies that have minimal effects on performance are gut content manipulation, that would be very low or restriction of fiber in the diet the days leading up to the event, body water manipulation, such as water loading, phased dehydration, fluid restriction, and glycogen depletion, and passive sweating methods such as the hot bath. And I'll give more specific examples towards the end of the presentation. Another very interesting thing that I found was that for athletes to avoid enduring long periods of low energy intake and severe weight cuts, it is recommended that athletes reach a certain weight range before even trying to engage in acute weight loss and chronic weight loss strategies. So for example, the UFC Performance Institute, they track the progress and they test the athletes competing in the UFC, and they found that athletes, if they're competing up to 2 weeks prior to competition, they recommend that athletes are approximately 8 to 10% above their competition weight. 6 weeks prior, they should be at or less than 12%, and overall, to maintain their weight year-round, they should be at or less than 16% above their competition weight. And this, again, is to avoid enduring long periods of energy restriction and severe weight cuts. And so now merging in both, putting the things together for the nutritional and exercise strategies for weight cutting, I created a sample 12-month microcycle, a strength and conditioning program for a female MMA fighter weighing 150 pounds. And her goal was to get to 130 pounds. And so overall, I split it into 3 phases. The preparation phase, that is mesocycles 1 and 2. The off-camp phase, mesocycles 3 and 4. And the fight camp, that was mesocycles 5 and 6. And so currently, it is very common for MMA athletes to only program for the off-camp phase and the fight camp phase. And during the off camp, they schedule the fight and they need to program and plan for their weight descent. And or during the off camp, they are also recovering from injuries from a previous fight. And they also have the fight camp phase, which the focus is on MMA specific training and to prepare to fight their opponent. So there's not a lot of emphasis on having a year-round approach where the recommendation, the programming allows for sufficient time to cut weight or reduce ideally body fat and make the weight descent a lot more doable for the athlete. And so the fight week also is a week in which athletes also only put all their time and effort to focus on making weight and engage in the acute weight loss methods. And for this example, I'll be talking about the low fiber diet, a water loading, and the dehydration. So for the off-camp phase, it included the chronic weight loss strategies as well. So the main focus was resistance training and endurance training. The purpose was general preparedness for strength training, and the strength and conditioning was linear periodization, and the MMA was daily undulating periodization. And so the training was to acquire a base of strength and power. For the fight camp, and taking into account the acute weight loss requirements, this focused more on the strength and conditioning was going to supplement the MMA training, and the MMA training was going to be the focus. So the purpose was for the strength and conditioning to be sport specific, low volume, but high intensity, designed according to the demands of MMA competition. And so for the 5-minute round fight, and overall to improve power production. And so some strength conditioning considerations that I talk about are regarding the practical and mechanistic considerations. Concurrent training, that is strength and the MMA training, can have very minimal interference on the neuromuscular adaptations, and that the interference effects of resistance training and endurance training can be minimized by scheduling morning MMA sessions and evening strength training sessions. It could also be split into high versus low intensity, daily or weekly, and moderate, high, and low weekly volume. And also strength conditioning tactics to be avoided specifically during the weight loss phase are hypertrophy training, heavy eccentric loading, slow tempos when lifting, and high volume of resistance training, all of which are key drivers that elicit muscle hypertrophy and that can potentially interfere with an athlete's ability to make weight. So these are things to take into account during the acute weight loss phase. right? So for the nutritional needs for the female MMA athlete weighing 155 pounds, the goal is to lose weight at a rate of 1.2 pounds per week, and ideally to get to the target weight of 135 pounds, and only lose the rest of the 5 pounds or up to 10 pounds via acute weight loss strategies. And we have 25 weeks to do so, plus the 1 week that would be the fight week, where we would do, if needed, more drastic acute weight loss methods that are still safe and effective. And I'll show an example in a second. During the off camp, overall, the training volume is higher, and according to her resting metabolic rate and exercise energy expenditure, she will be consuming between 35 to 40 kcals per kilogram of fat-free mass a day, enough to supply fuel for her resting metabolic rate and training while losing weight. And during the fight camp, the training volume will decrease, and it is expected that there's a slight decrease in her resting metabolic rate as well because of the weight descent. So low energy availability, however, will still supply enough calories to maintain her resting metabolic rate. So more into detail. During the off camp, she's going to be following a balanced energy availability. So she'll be ingesting approximately 2,000 calories, and she'll have, for the fight camp, a low energy availability of 1,700 calories. And the goal for this phase is that at the start of the fight camp, she must be 145 pounds, and towards the end, 140 pounds. And so here's an example of the fight week nutritional needs. So overall, she'll be following a low energy availability of 1,500 calories, and carbohydrates are going to be severely restricted to only 50 grams a day, 1 gram per kilogram of body weight. Protein is going to go higher, 2.5 grams per kilogram of body weight, and fat 1 gram per kilogram body weight. And so the goal at the start of this phase is for her to be at 140 pounds or 135 pounds ideally, and at the end of the phase at 130 pounds. So making weight for the fight. And so during this acute weight loss method, there's a potential for her to lose between 4 to 7% of her body mass. And this is totally achievable via fiber restriction and the dehydration method. So here I show a water loading method and fiber restricted diet and a low carbohydrate diet. So for 7 days out, she'll be consuming only 50 grams of carbohydrate per day. Fiber is going to be 10 grams per day for 5 days before weighing in, and she'll be following a water loading. So she'll be drinking 6,300 milliliters of water 4 days out, 5 days out, and then 1 day before weighing in, water will be severely decreased to only 900 milliliters of water. And then once weighing in, the post-weighing, she's going to consume mostly high glycemic index food, carbohydrates, fast digestible carbohydrates. It's gonna be still very low in fiber to not disturb her gut. And her sodium and fluid recommendations are going to be 1 gram per liter of water lost, and replenishing water at 150%. And this is an example meal plan that I created to take into account the fiber recommendations and carbohydrate recommendations. And so in conclusion, within this population, mixed martial arts and the in regards to safe and effective nutritional and exercise strategies. There's this a situation in which practice is informing research, in which we're, as researchers, taking what extreme weight cutting methods that athletes are using and analyzing and examining what is going on physiologically. And also, we as practitioners, as that strength conditioning coaches and dietitians, we are slowly but surely informing these athletes on better ways in which they can make weight in a more in a safer, and that will prolong their longevity in the sport and improve their performance and health, overall health. Here are my references. Thank you. I'll accept some questions now.